As a client and user of medical laboratory services, we want you to know that the Caribbean MedLabs Foundation, as a regional champion for quality in medical laboratory services, is working throughout the Caribbean to bring you quality laboratory services. Why are we doing this? Because we know, and you know, that medical laboratories don't always get it right. And when they don't, bad things happen. Here are some examples. Labs themselves are not immune from the effects of poor laboratory operations. Laboratory personnel themselves have been victims of HIV and hepatitis infections, as in this example from Maryland General Hospital in the USA. You as a client may be immediately impacted by poor laboratory services, as happened in Quebec in 2009, when 2,730 women had to be retested because of substandard hormone receptor testing. In the meantime, many received incorrect or inadequate treatment. Botched DNA evidence led incorrectly to 16 months in jail for this young man in Australia. He was convicted despite the fact that he was at his dying father's bedside when the rape of which he was accused occurred. And we have several examples here in the Caribbean. One Caribbean government had to compensate a woman who was misdiagnosed with HIV while she was pregnant to the tune of $9 million. Her baby was born blind, she suffered shame and loss of her relationship, and she thought the blindness was caused due to the medication she was given. In another Caribbean country, the government lab mistakenly identified 8 mothers as HIV positive, and treatment was initiated. So lab error affects you, there's no doubt about it. Incorrect results cost both lives and money, and lab quality matters. It matters to you. CMLF helps to ensure that medical laboratories get it right by working to improve lab quality throughout the Caribbean. Did you know that internationally it is estimated that 70 to 80% of clinical decisions are influenced by lab data? But only 5% of national health budgets in most countries go to the lab services. As users of laboratory services, and we all are at some point, we should choose our lab carefully. Ask our doctors about the lab he recommends. Is it accredited? How does it ensure reliability? Ask to see the label or ID on your sample. It's your right. Do you understand the implications of your test results? Check with your doctor and trust your instincts. Get a second opinion if the results are surprising to you or your doctor. It's your right. Follow up with your doctor or the lab. Make sure you get feedback on your results. Don't assume. Remember that laboratories have a duty to provide a timely and reliable result to every client. Lab quality needs standards, national policies, laws and regulations, resources, and institutional will. Most of all, community advocates like you are key. Remember, medical laboratories don't always get it right. We at CMLF help to ensure that they do.